Hi, I'm Heather Richard with the Clinical Education Department, and today I'm going to discuss continuous bladder irrigation, or CBI. So, first thing you're going to do is check your physician orders, especially noting the irrigation solution prescribed. It can be either normal saline or sterile water. Once you have all your supplies gathered and your orders checked, you're going to insert the Foley catheter and get the system set up on your patient. First, before you insert the Foley catheter, you're going to set up your drainage system, your irrigation system, okay? It's special tubing. You'll see that it has two sides, but it connects kind of like blood tubing. And first you want to do is aseptically spike your solution, all right, and prime your tubing, making sure your drip chamber is 50% full, all right? Once I've gotten my irrigation system ready, I'm going to aseptically insert my catheter into my patient. You'll note it's a little bit different. It has an extra port. That is for the irrigation to the bladder. Once it's inserted, I want to make sure though that I have my flow chamber clamped all the way. Then I'm going to aseptically clean the port of my catheter before attaching my irrigation tubing. All right, so now I have my catheter in and I have my tubing connected. Now I'm going to connect my catheter to my patient's leg securely, either by a Statlac, or we also have a strap in the Pyxis as well. Whatever works, you want to make sure we don't cause trauma to our patient. Now you're going to use your flow meter to decide the rate of the fluid, okay, going into the irrigation into the bladder. You're going to adjust this per your prescribed rate by your physician. The goal of this, though, is to make sure we have enough fluid going into the bladder to maintain a pink color in our Foley bag, okay? Once we've done that, a couple things you want to remember. You want to always have extra bags on standby in your Pyxis because you never want to run out of your irrigation solution. We never want a dry bag or a dry tubing going into our bladder because that could cause complications. It could actually cause clotting to our patient, which is troublesome and very painful. What do we do if we have a clot? Your patient will scream, but other than that, you're going to stop the solution and declot the patient. You need to get a doctor's order for that and utilize a proper PPE, which is a gown and definitely a mask with a face shield, as well as an irrigation tray from your Pyxis. All right, so once we've troubleshooted our CBI and everything's going smoothly, you have to remember that all these patients must be on strict INO. So get that doctor's order for strict INO and communicate all this to your team that the patient is on CBI and that they are on strict INO. Thank you so much.